pills try to get at you. Drop them in the box, drop them in the box, drop them in the box. Don't leave them on the countertop. Drop them in the box, drop them in the box, drop them in the box. No cure for disease of addiction, but our best bet is to start with prevention.
Hey, one of these days, Jimmy, we're gonna get you unmuted.
I'm unmuted, man. What's
Yeah,
up?
I'm so glad to see you. We've got a
I'm-
great guest today. We can't wait to start the conversation. But real quick, the Recovery Clinic, what it is, it's a place for you to come find accountability and support during COVID-19 and beyond, and to stay engaged, to not feel like an island of one. We're all here to help. We're going to have engaging discussions, topics of interest, and so like the video said, if you have a comment, concern, or just want to share in general, drop it in the box, the chat box.
the chat box. But hey, as always, please remember we're a very public show. And so what you write in the comments will be there forever. So be mindful of that if there's something you don't want to be out in internet wonderland for the rest of your life. So big shout out to everybody watching. If you haven't already liked and followed the page, the Recovery Clinic, go do that now. Hit that like button. We need your support. This is how we reach people during this time of crisis. Ain't that
Absolutely.
right? Ain't that right, Chris?
That's right. So, we've been doing these for a while now, and we have enjoyed our discussions. We've enjoyed our viewers' engagement and being real in the chat box and being open and vulnerable. It's, offline, Jimmy and I get messages all the time about, people, finding the peace and calm during our shows. That they're looking for, that they can take and apply in their daily life. Some of the things that are suggested, and even in the chat boxes. And so, a big thank you to all the people that when someone has a problem in the chat box, they're swarmed with people trying to help, and that's what it's all about. So,
Yeah. So we got a super special guest for you guys today. Chris, you want to tell them who he is?
well, I'd love to. So, I think as in the video anyway, I was gonna have a surprise, but it already says so. We're excited to have the state drug director of Arkansas with us today. We've been, obviously he's busy. There he is. He's super. You know, we're going to find out about what he does and what his role is. But we're excited to have state drug director Kirk Lane with us. How you doing?
Hey, what's going on?
Oh, we're just hanging over here.
We got it figured out. We got him in there. Got him in the box, Chris.
Yes,
He put me in the box once or twice.
he did.
Now I got him in the box. That's good
The
stuff.
tables have turned.
The tables have turned. We were just talking about Kirk, and I had a picture of me, you, and Chris from a couple of years ago where I really wanted to show, but I'm afraid with all the stormy weathers it'll be technical. But it's you're pretending to arrest me, and Chris is behind you like, yeah. And when I look at that picture, I think of how leaders make leaders. And you've really kind of led the way for the rest of us to have the opportunity, even this platform. Chris, what do you think about that? You think leaders make leaders?
So, well, let me jump right into this question I have for you, Kirk. Obviously, you have a history of leadership in law enforcement. So, when you took over the position that you hold currently as state drug director, that was it was. Were you seeking that out? I mean, because America at that time was starting to have a critical mass of some really dark times with the opioid epidemic and the addiction crisis taking full shape. So, with your leadership, we are where we are today. But talk to us about what you felt, what you saw while you were getting ready to take on that role.
Well, I first got into this in about 2009, 2010, um, as being a new chief of police and trying to affect the community. At that time, I was working in Benton, city of Benton, um, and coming into contact with different people that influenced me into this issue and trying to look into drug take back, overdose, things like that were happening in our community. But more importantly, how law enforcement really wasn't prepared for it based on the training that we had always did and how we needed to do something better.
Absolutely. And so I think for those who don't know, what is the role of a state drug director? Because it's not just, people might have their own idea, but tell us what the role is.
So it's
Yeah.
multifaceted, that we advise on drug policy. We work with overseeing the state funded treatment and prevention programs in the state. We oversee and are the record keepers for asset forfeiture in the state, fiscally responsible for the drug task forces, drug task forces in the state, and then anything else that they want to give me that becomes part of our role.
Yeah. Not to mention treatment, prevention, and recovery, right? Like
Oh,
you're over all those.
absolutely.
Yeah. So when you took your job, did you ever foresee like Arkansas becoming the leader in recovery efforts that we are today?
I don't think when I first took the job, no. I think, to be honest with you, I saw some ways that I thought that I could improve it based on my law enforcement background, things that we could improve with on the enforcement side, things that we could do on the prevention side. But quite honestly, the treatment recovery side was new territory for me, and I knew I had a lot to learn uh, going forward with that. So I kind of immersed myself in getting with people that were next to it, trying to learn what was needed and what we needed to do and what the challenges were. And I guess the biggest thing is trying to get that all-in approach where everybody gets all in and starts affecting this problem effectively.
Absolutely. Real quick, hello to Karen, Bonnie. Bonnie was talking about that picture being taken, and it was actually to something you just mentioned, Kirk, about eliminating stigma. And the way we do that is to normalize the conversation around addiction and mental illness. So that picture was actually taken at the Breaking the Stigma baseball game at the Travelers. So
It was a great
wanted to make that note. Hello, Kyle. We're so glad you're here. Deborah, Billy Frank, Sharon.
Yeah. You know what, Chris? I've got to say this while Kirk's on here. As I scroll through these names in the comments, right? Like these are recovery leaders in Arkansas, and I can count 5 of them that were arrested and incarcerated by Kirk Lane when he was a police officer. Like real talk, you've got myself, of course, everybody knows the cops and robbers story between Kirk and I, but then you've got JD Skelton, who Kirk literally like, and I don't mean to make anybody feel weird, but this is the process. This is the full circle, Chris. Like, so while Kirk was busy trying to arrest his way out of the problem, which was what he was just talking about, and that didn't work, you got people like JD Skelton, who also Kiri Partington, who's actually on here as Kiri Killian. And then you've got Billy Frank Ventura. Like I could just go through this list of recovering people that are in recovery today because you played a role in it, not even intentionally knowing that you were playing a role in us finding recovery. How does that make you feel?
Oh, it's great. I mean, I get to see the full circle of it. I think anybody that becomes a police officer generally wants to get in there to try to make it a better world, to try to do things. And I think, when you first get interviewed for the job, why do you want to become a police officer? And it's, I want to help people.
Right.
Really, when you deal with the day in, day out issues of law enforcement, sometimes your focus gets a little jaded. You always see the bad things that are going on and not the good things. So it's so enlightening now to see all the great things and the things that are happening, seeing a part of what you had a little piece of doing and how it's coming forward to make people's lives better. It's refreshing.
Yeah.
Absolutely. So when you took over the role of state drug director, you didn't really. Do you have one of these?
I do.
So it wasn't the flood of naloxone in Arkansas wasn't where we are today. Talk to us about how you decided to build those initiatives in the state. And for some of the viewers that aren't aware, talk to us about naloxone and because when you took over, Arkansas was having some pretty high rates of overdose, and we're trying to triage that situation and wondering what to do. And so, thankfully, you built the initiative to invest in naloxone and messaging and getting the word out that what it is, what it does, and how to save a life. So, talk to us about how you developed that program.
So, in 2015, I attended the Prescription Drug Summit. I was a participant in the organization of that for my role with the chiefs of police. Met some people out of Massachusetts that were presenting on naloxone and listened to how they developed their program in Massachusetts. So we did a lot of studying, try to develop policy, try to dot I's and cross T's on how we could develop our own program in the city of Benton. And in the fall of 2016, we were actually able to develop the first police program for the state with policy and everything else that included in that. And in October of 2016, we had our first save from a heroin overdose. And at that point, really became believers when you see it happen. It makes a believer out of you and realize that we needed to take it forward. So in my new role, that's something that we wanted to do, and thus built that program from there.
Yeah, because I think one of the key ingredients, I guess, is your background in law enforcement, and to show that there's a different way to approach this, right? And so I remember seeing a lot of news stories coming out from different counties in Arkansas, and on social media, on the news, with law enforcement officers showing their support for naloxone in this initiative, which I thought was great because, like what Jimmy was talking about, when someone takes the lead, it's easier for the next person to take the lead, and then so on and so on and so on, and all of a sudden you've got a movement.
Yeah.
Sure. I tell you, the movement kind of culminated. I'll tell you this story that last Friday I got a call from West Memphis Police Department, who on Wednesday of last week had the deal where they had an officer in a foot pursuit of a suspect, and in the arrest of that suspect, that officer somehow or another came in contact with the substance that was on that person, and in 30 minutes became unconscious and stopped breathing. They had the presence of mind to give naloxone, thus bringing him back to breathing. They were able to transport him to a Memphis hospital, and the physician at the Memphis hospital attributed his life saving to naloxone. They said that if they hadn't applied naloxone, that officer would have died. And so that's a good thing.
Yeah, and I think part of that, when you say the presence of mind, is some of the funding that you've been able to allocate towards messaging, towards don't run, call 911, towards Naloxone saves lives, period. And so, you know, because I talked to you recently about losing someone close to me to an overdose, and we're dealing with fentanyl, which is a game changer. I mean, it's unlike any other substance out there. It doesn't give you second chances. It takes and takes. And so traditionally, Arkansas has been a meth state. So talk to us about when you started seeing this substance that you know, just taking people out, and kind of what was going on at the time when you saw that.
Well, let me go back and say that this has not been a one-man crusade. We have tremendous partners throughout the state, whether it be the Drug Take Back or the Naloxone program. The Criminal Justice Institute has been one of our great partners and really helped us promote the message.
Yeah, I love me some Cheryl May.
Training of that in there. And it's been an invaluable partner to what we're doing. But going back to answering your question, methamphetamine still is the number one drug threat in our state. We see that time in, time out. Statistics show us that methamphetamine is still what the highest level of overdose, fatal overdose, has methamphetamine mixed into it. But the problem that we started seeing, being the number two prescribing state for prescription opioid, the high level of opioid dependency because of that we have in our state, and then being a state that has always been fueled heavily by the Mexican cartel, whether going through or ending up in our state. We have some real issues with methamphetamine, heroin, illicit fentanyl, and things like that in our state that really start to see some devastating turns of high opioid type or opioid combination type deaths involved with methamphetamine and whatnot. So it really is a purpose to try to get that messaging out there, try to build those partnerships in those communities to make the difference.
Yeah.
Yeah, what we do isn't for the faint of heart. I mean, it's addiction's obviously devastating, and it's very destructive, not only for the individual, for the families, for the communities. I mean, for you know, law enforcement, you know, hospital staff. It really does have a ripple effect that's far and wide. Billy, we're so sorry to hear that you lost your daughter in February to fentanyl, and reasons why we fight so hard to keep our voices loud enough so people don't have to die quietly. You know, Sherry, thank you for you know, sharing what you just shared. And Whitney says, I have done Narcan training with an overdose response team. It's an amazing thing, which speaks to some of those partnerships, Kirk, about, you know, getting people trained up so they can take back the experience and the knowledge and the application to the respective communities.
I want to jump in right here, Chris, and I want to pull up Kayla Ray on here. She is actually one of my wife's closest childhood friends, right? And so we were able to help her get into treatment, and we actually used some of our resources to do that. And she's active in recovery today. JD Skelton, who is actually one of the people that Kirk arrested and helped get into treatment, right, was able to help Kayla in her early recovery with from all the way from the getting into treatment, aftercare, after treatment, and now she's in sustained recovery, right? She's living in Hot Springs. She's active in her recovery, and she would not be alive today. She says, I wouldn't be alive today without Narcan, thanks to the emergency responders in Sherwood, Arkansas. So like this whole chat box is full of people. And big shout out to Tommy Norman for sharing the video. I can see we've got multiple hundreds of viewers. So if you're watching this right now, please go like and share our page. This is how we carry a message to save lives. And so thank you for sharing that, Kayla.
Yeah. So here's a good segue I want to talk about. The International Overdose Awareness Day is coming up in August. It's August 31st every year. And Kirk, you've spoken at that every year at the Capitol in Little Rock. We've been of it. It's important to us to be there. Jimmy's wearing the colors of that day on
Purple.
And so one of the things that we're doing a little bit different this year is a way to, since we're talking about people who are saved through Narcan that has another chance to live and recover out loud. It's a way, the Overdose Awareness Day is for us to remember who have fallen, and to remember those families, and to remember those who may not die but are affected in due to severe brain damage as far as an overdose. So International Overdose Awareness Day is to think about those things. We have reserved 3 bridges in Arkansas. And we're going to light those things up purple. And so be staying be looking for messaging coming out on what we're going to do. We don't know everything we're going to do yet. But we do know that the bridges are going to be purple, and we're going to do something around that. That's so, great. Yeah, no, we're looking forward to that. And so, Jimmy, talk to us about a little bit with your relationship with Chief when he was, trying to keep you from being a menace to society.
So
everyone does know the cops and robbers story. So.
Yeah. So if you don't know, I am probably the oldest I'm amongst the oldest state employees in the state of Arkansas, Chris. I don't know if you know that or not. I just get paid for it now, but I've been working for the state since the first time he put me in prison. So it's really cool. For a long time, and like I'm reading these comments of people like Sherry said you arrested her 3 times in your law enforcement career. You saved her life. My cousin Kiri's on here. Yeah, I mean it just goes on and on and on. And that's my story too. For a long time I blamed Kirk Lane for everything, Chris. He was the boogeyman. I had an inability to accept my personal responsibility, so it was never my fault. It was always his fault. It was always the cops' fault. Never did it occur to me that it was my drug use, right? That I was the problem. And
Kirk, how did you always know where he was? Was he just pretty
to find?
No, I got told on. I'm sure somebody told on me.
Hey, to all the new viewers that just came up, we're so glad you're here. Tell us where you're from. We want to know where you're viewing from. And Walter, thank you so much for what you do. So, Kirk, he was always easy to find. Did you ever have any conversations with Jimmy about trying to get help, or was he just too far from it at that time?
No, Jimmy and I had several conversations, mostly about what he had done. And we had conversations about what he could do, but Jimmy never would go that route with me. But I remember quite often how entertaining Jimmy was, and I remember actually walking him down to the old bookend section of the jail to put him in that bookend section on one time. And when I walked away from there, I was like, he really is a good guy. He's just, I wish he would straighten his life out. And I think that was the last memory I had of Jimmy until actually the overdose awareness deal, where he was presenting and I was presenting, and he started telling me or telling the audience about the contact we had, and I realized who he was and how our paths had crossed in the past. So that was kind of a neat deal.
Yeah, I often joke that I followed your career from the beginning of a patrolman to now, just from the backseat of the cop car.
You were trying to be a backseat driver?
Yeah. Well, and I'm going to tell you something. He really did try to, he was always nice to me once I got caught, because I stopped resisting, you know what I mean? But I'm like 6'9", you know what I mean? Like, I'm not going to play tough today. I'm telling. If I get in trouble, I'm telling on you, your mama, everybody with you. You don't want to be in the car with me, because I'm not. Hey, listen, I'm telling, Chris. And so
You're
everybody,
Takashi 6'9".
I'm Takashi 6'9". Boy, I'm gonna tell on some stuff I seen your girlfriend do 6 years ago. Like I'm telling it. Like, I'm just telling you, I'm gonna save myself because you're not gonna save you. That don't make sense. But anyway, listen.
Hey, real quick, Desiree from Albany, Houston, Texas, representing Billy Frank. Tiffany from West Virginia. Trina Shea from Texarkana, and then Renee from Cabot. You've got all these people, and then Cabot. I love it. Thank you so much for viewing. We're glad you're here.
Yeah, we've got an awesome show, and it's just really cool to see it come full circle. But once he saw the change in me, Chris, at that state capitol, there was a couple of hundred people there from recovery.
Hold on. Let me stop you. What year was that?
That was two. What?
That was
Go ahead.
17.
Yeah, it was 2017. Yeah.
Okay.
But the door opened right there. Like I think for the first time, and even in the book that I'm writing, I refer to that day as the day that the recovery community was able to shift the perception of a decision maker. We had no idea that Kirk was in the position. We didn't even know what a drug director was. And so like he said in the beginning, recovery was a new concept to him. So that day he saw me and other people that he had once arrested, and we had been considered probably the most likely to die in addiction or prison. And so from that day, a success story happened between Kirk and I. Two communities came together, and we began going out to the colleges and speaking to different colleges. And we went to Monticello, we went to Arkadelphia, we went all over sharing recovery. And it's really cool, man, to see what Arkansas has done from that one day.
Yep.
That's all I got.
Kirk, I want to show you kind of how this little chat box works. I know you're familiar with it. Angel just said, "I need help," and sweetie, you are in the right place. We're so glad that you said that. In the time it took Jimmy to share that story, people have already started the process of getting her help. So this is what this is all about. Like I said in the beginning, please don't be an island of one. The intro video has a lighthouse with some choppy water. Get to the shore, and the recovery community is waiting to wrap their arms around you to help you find what you need.
Yeah. And Angel, it doesn't matter that you're in North Carolina. Recovery is a global connection outlet. And so we've got people in every state, and we can definitely help you get that. Just message us and we will find somebody to get you help in your state.
Absolutely. And so, kind of touching on that, it really brings to light what America's going through right now, Kirk. Talk to us about what you're seeing as far as what COVID-19 to Arkansas.
I think I was fearful of COVID-19 more for what it was going to do to people in recovery and what it was going to do with people in substance use disorder, more so than the danger it was to them just being COVID-19. We have made considerable progress in the last year of reducing numbers and saving lives. And I knew the isolation and the desperation, economic despair was going to cause people to reuse or to use more. And I'm really worried about where those numbers are going. We've seen a spike in our naloxone administrations. We've seen a spike in suicidal overdoses, almost 4 times what we did in the March and April of 2019. And we're still seeing those numbers climb. Where we're actually saving lives, I'm worried about the numbers of the lives that we're not able to save, where people are in isolation. They don't have somebody around them that can save them, or feel fearful about calling somebody. I worried how law enforcement and some of the first responders that have naloxone, how willing they would be to save somebody and contact with somebody, because it's really getting in somebody's personal space, which is not allowable under COVID-19. But I've seen a lot of people step up, because look at the number of safe, more than we ever had. people are really stepping up and calling to their responsibility because they know their responsibility in saving lives. And it's not just putting people in jail, it's actually saving lives and giving direction to recover. So, as unfortunate as these numbers are and are still going to be and growing, it just makes us work that much harder for all of the staff, from the drug director's office to DAA, BHS, and prevention and treatment. We have to find innovative ways to get that messaging across.
Absolutely. And so you touched on something that is critical, I think, in general, but for someone in recovery, it's even more important. How many studies and research has been done on the importance of human connection? I mean, your concern is one that I share with the wave that's coming of people that are going to be seeking help, and so we got to remain accessible. We got to remain open. We got to remain available to people that are hurting. Tiffany, congratulations on your 8 days. That's wonderful. We're so glad that you're here to share that with us. 8 days. What a time to what a great time to recover during a global pandemic.
Yeah, so 8 days is freaking amazing.
Great.
Like I remember when I couldn't get 8 hours. Like I would literally hate myself because I didn't want to use and I would use anyway. The only way, Tiffany, I was ever able to get 8 days was incarceration. And that's just honesty, right? Like, so my hat is off to anybody who has found the ability to recover one day at a time for 8 days in a pandemic. That's freaking
8
amazing.
days. 8 days in a pandemic is like 8 years, right? In quarantine time.
Yes, like dog years, like 7 times 21. So, what you were talking about with the rise in the spike in overdoses and suicide, of course, when you talk about overdose, we think fentanyl, opiates, and heroin. And so that's going to lead to MAT recovery or MAT treatment, right? So can you talk to us about MAT and MAR and maybe MAT versus MAR? I mean, what's your viewpoints on all this? And go ahead.
I don't really distinguish between them. I think we called it MAT. It really needs to be called MAR because that's what it is. And I think when we make stuff too technical about treatment, and treatment, it really is a part of recovery. I think it's better to call it what it is. And it's really medicated assisted recovery. But MAT is no different than anything that you do on any type of illness. We all take an aspirin for a headache. That's MAT. It's medication assisted treatment. If you had the flu, other than COVID-19, there's vaccines and there's medicines for those. That's MAT. And so I think it got stigmatized about it. But when you push it as MAR and they see it as part of the big solution, you start reducing that stigma and start people that really need it or people that need to believe in it, like families of people that are afflicted with substance use disorder, then that is a big plus. And anything we can do to reduce that is life-saving to society.
Right. Yeah.
Yeah, it's just an arm of it's an arm. It's a tool in the toolbox. Is it for everybody? No. Is it effective? Yes. Are you in recovery? Absolutely. You can't recover while you're dead.
That's right. And so a lot of the stigma though comes, I think, Chief, my perception toward MAT really shifted. Of course, it began shifting as I was learning about it working under you. But when I think about Paula Cunningham and Gina Aguilar and Stacey James and these mothers who are advocates leading for other families, like if it were my child and it came down, would I want my child on MAT instead of versus death by overdose? Absolutely. I would want my child alive any way I could have my child, whether it was on Suboxone, Vivitrol, it wouldn't matter. you know, and so that's the way I've got to look at it. Like, but we're so judgmental. Even the recovery community stigmatizes
That's a big
MAT.
part, not even. That the recovery community is brutal.
Yeah, yeah, they are because we don't understand new ideas, right? Like, because you don't get clean that way, just because every other thing didn't work for me doesn't mean something else won't work for another person, right? Like I found abstinence-based recovery when I exhausted all other avenues. When all my other options were gone, nothing else worked. I found what works for me. But why do you think it's so stigmatized from the recovery community?
I think we get into ruts in seeing what might have worked for somebody and believing that'll work for everybody. And if we don't keep ourselves open minded and listening and watching what is working and being available to have different pathways to recovery, whether it be Suboxone or Vivitrol or what other drug comes down that becomes FDA approved, and work towards, honestly, working towards an abstinence based recovery is the goal. But some people just can't achieve that. The draw, the cravings, and the things are just too immense. And they just can't get to that. And that's where MAT can assist them in getting that. But all people should work towards an abstinence based recovery, in my opinion.
Right.
Uh, and we see where that works and see where we can sustain that sobriety that is part of the win-win equation.
Right.
Well, you're right because what we're talking about, this medication it was designed for short-term use to get over the withdrawal and the craving, right?
Yeah. So do you think a lack of education, and I don't know a politically correct way to say this, right? But like the medical people who, unless it's a doctor like Dr. Michael Mancino, who is an addiction expert, right? Like, but most doctors that can get DEA waivered, they're not trained on addiction, much less recovery, because nobody's really trained on recovery except for recovering people. And so a lot of what we see, especially, and I can speak to this because I'm a national advocate. I work for the state of Arkansas, the drug director's office. And what I see, Chris, is people being prescribed a script of Suboxone for a year and a half, 2 years, right? And just coming in once a month, meeting with their doctor, sitting down, telling the doc what they need to hear to get their script, and then they're gone. They have absolutely no recovery support going out of the doctor's office with them. And so that's where my underlying issue comes from. Now, you guys may see something completely different.
Well, you're going to have manipulation in some form or fashion with anything.
Yes.
Someone's always trying to ruin it for the whole group. So as we continue to educate doctors, because you're right. I mean, I think there wasn't a lot of money in research for an MD wanting to go into addiction medicine, right? There's just not a lot of money there. It's
Right.
more attractive, sexy to go be an oncologist. That's where the money is for research. And so as we're starting to see the shift, there is money available in addiction medicine, and so more people are coming to the table to help. But I think, Kirk, you can talk to how many doctors we have on board now for being a DEA waiver doctor.
Yeah, so when we first started this program under the SOR grant on the education part, and where we partnered with Dr. Mancino, we had about 70 something doctors that were DEA waiver that could apply MAT in the state. Now we're up over 300, like 350, and we've gained so much ground on there. And a lot of it was education, breaking down the stigma walls with doctors, getting them to realize that this was a solution to the issue. But with that said, we still have probably a quarter of the state, and talking about counties, that don't even have one doctor that can provide MAT.
Yeah.
So we put a lot of pressure on our doctors. We have tremendous medical doctors in our state, But I think the big thing is trying to get those communities engaged to demand good medical attention, to demand that we do something to become all inclusive and not it's your job or your job or your job to do something. It's all of us working together to make this solution go away. Look
Mhm.
at COVID and look at the daily reports on COVID. What if we applied that same concept to dealing with overdoses and we're
Yeah.
able to see this and track that? How many more people would get involved? How destigmatized would we would be? How destigmatized would it be? And
Yeah.
now it would be cost. It wouldn't be probably cost efficient because look how much COVID has cost us. But how much are lives worth? How much are we going to get involved as a community, as a society, as Arkansans to be all in this problem?
I think that's a great frame, the way you frame that up to think about. Um, Amy Scarborough says any way these docs can find a way to include the support aspect and what they would do exactly. Amy, that's a great statement because um, we don't want to do the bare minimum. We can't afford to do that. Resources
Right.
have to be equal. And so sometimes, I mean, let's just say the FDA has the guidelines. They say in addition to these prescriptions, these people should be offered a multiple levels of support. Through counseling, through other therapies, and activities that are conducive to build a recovery foundation. So thank you for saying that because those guidelines do exist. We hope that that they're being followed.
Yeah. Absolutely.
If I can say something to that too, uh, in our grants, we wrote in those partnerships. The whole peer program, which helped support the big peer movement, was written into those grants where those doctors or those providers to provide medication assisted treatment and then also partner with peers to help sustain that recovery was a big part of our grant that we wrote in the past and we got passed, and what we're writing right now in the new grant, that we're expanding those peer programs and the qualifications of the peers because we see where those when we partner those two things, it really works.
Yeah. Yeah. That's where you see, that's where we have previously seen, and that's where other states, when you're just basically providing buprenorphine, you see a rise in the quality of life in the beginning, but then suddenly drops back down. But when you pair recovery support, such as peer recovery, with MAT, it truly becomes MAR, medically assisted recovery, because the difference between the clinical services that Chris was just talking about, for those watching and don't know, uh, the peer specialist goes home with you, as to where uh, the counselor or the therapist, they don't and they can't. It's kind of against their scope of practice. But as a peer specialist, that continuum of care goes with you all across the continuum of the recovery process. So that's where they're getting introduced to the recovery community. They're realizing that people can and do have fun without drug use. They're getting introduced to cookouts and campouts by recovering people. And they're like, all of a sudden, hope is implanted. And so they're like, well, hey, maybe I can get there too. And so that peers providing options and asking questions, are you living your best life on MAT? If we were to remove MAT, would you spin into chaos? And so that's the goal, is to get them introduced to it. And so thank you for also providing that doorway for us, Kirk. That's huge.
It's been a great partnership.
So
Hey, I want to for people who are just joining us, we're talking about all things recovery in the Recovery Clinic, and we have a guest, the one, the only Arkansas State Drug Director, Kirk Lane.
big dog. So tell us about the Narcansol app.
So, as we started developing that Narcan training, we had so many requests from different groups that wanted to get that Narcan training, and we realized that it was very important, very simplistic, very important. There were several different apps out there. I think early on in our development of that Narcan program in Benton, how we had an app that we turned to, actually filed that app on the day of that save that we had, that first save. So we want to develop something that was more inclusive for Arkansas, that gave resources that connected people, not only to save somebody, but to get good information about recovery, treatment, prevention, the Arkansas Take Back. But we developed that app and we coined it in Arkansas, um, as a catchy name on there, so people could get that training, that they didn't have to go through a formal training course, and see how simple it was. In the last month, through the Criminal Justice Institute, we've been able to make that app actually talk to you, verbalize the instructions, which is phenomenal in what it's able to do. You can listen to it in Spanish.
Wow.
So we're trying to make it applicable to any race that's out there, any gender that's out there, any nationality that's out there. Anybody that has to use it, they can get it and they can learn it. They can familiarize themselves with it and actually be that first responder that saves the lives of others.
Absolutely. I don't know where Chris went, Chief. Can you see him, or did he hop off the screen?
I think he popped up.
Yeah, it must be we're having some iffy weather here in Arkansas. So hopefully Chris will be back in a moment. And if he does, we'll bring him on. So the Narkansas app, you can go download that right now, right? And anybody can have it.
It's free. It's free, and you have all kinds of resources on there. Almost all the resources that the state has, you can connect right there on that Arkansas app, and you can hit that Rescue Now button if you have to. It'll call 911 for you. It'll allow you to save somebody, walk you through the simple steps to save somebody's life.
Right. Yeah. And so it also has the state funded treatment centers on there, right? Like if you need to find treatment and you don't have insurance and you need to utilize state funds, those are the providers. Are those the providers they can go get treatment through state funding with, or can they do that with any provider?
Those are the providers that we fund. Now, some of them have subcontractors that they allow those monies to go to, but that's a point to start at. If you have where you are underinsured or you are uninsured, you need to contact one of those providers on that site, and they can help you find the closest one to you.
Okay, that's awesome. Chris, you're back.
Yeah, I came in just in time where you were talking about how to rescue somebody, and then it happened.
Well, you came in to rescue me because I was running out of stuff to say, bud. I was like, oh, God.
Yeah, right. I'm not believing that for a second.
Yeah. So we were just wrapping up talking about in Arkansas and how to utilize state-funded treatment and all the cool stuff that app does. And so while we're talking about apps, Chief, I want to go ahead and surprise you with something. Because you made peer recovery possible in the state of Arkansas. Why are you shaking your head, Chris? Or you're like, oh, God, what's it gonna do? I'm going to pop out of a birthday cake in my birthday suit or something.
Duncan, you got Hazel coming out.
Yeah. So we are currently testing. We're in the testing phase of the new peer recovery app for Arkansas. And so I've been playing with it all morning. It is freaking amazing. So thank you to the Information Network of Arkansas, who have stepped up and helped us save lives and develop this app pro bono. And they've turned it over to the Arkansas Peer Advisory Committee, which is a subcommittee. For those of you watching that don't know, is a subcommittee for Kirk's Alcohol and Drug Coordinating Council. And so that app will also be live. I believe we're targeting next Monday. It will be up. You can go view the website, though. It's arpeers.org. And so it's really freaking amazing. It's got everything a peer specialist could dream of. And there's a login side, Chief, for people who know. Surprise.
That's awesome. That's awesome.
Yeah, that is.
Hey, I want to give a shout out to Amy Scarborough. She says she's a super fan of all three of us. I love it. Thank you so much.
That's
We're a
because
fan
he.
of you, Amy.
That's because he arrested her too.
You didn't have to say that. Hey, Teresa says, thanks for the update. We live to update. We live to be of service for you.
This is true.
I thought JD said, okay, boomer, but he was giving a shout out to Mary.
Yeah. Mary Boomer.
Yeah.
Hey, if you guys see this number down here scrolling across the bottom of the screen, that is the DHS Mental Health and Treatment Call Center line. If you call that and you're living in Arkansas, Monday through Friday, 8 a.m. to 4:30, someone will be able to answer that and get you connected to a funded treatment center. So we are here. We want to help. We want to be your connection resource, basically hub.
Yeah, I love the people in our chat box that are, going above and beyond in my mind to make themselves available and putting their personal cell phones out there. I mean, this is what we're up against. We're not, look, we're having fun today. We're talking about some serious things. We're talking about, some lighter things, but we know right under the surface, this is a life and death situation for many, many, many people. And so we understand the gravity of it. So we thank you for being available and accessible by sharing your phone numbers for those who may be hurting.
Awesome. So what about this? The drug take back. Who's going to tell me about that, Chris?
I believe Kirk is. He's the one who invented it, isn't he?
So, yeah, well, it's a combination of things. So Drug Take Back is a great program, started in 2010. Since that time, the state has collected and safely destroyed over 187 tons of prescription medications.
Wow.
So think about that. If we had our drug take back, which was supposed to have been last weekend, we would have probably been well over 200 tons. But we intend to still have it. We're waiting for COVID to lighten up a little bit where people can get out and destroy their meds safely. It's about monitoring, securing, and disposing of your meds safely. That was the whole program of the drug take back. Wasn't to see how many meds we could destroy, but actually to educate the community about safely monitoring, securing, and disposing of those meds. Because we know that over 60% of the meds, prescription meds that are come from our homes that are abused. And so we tried to find a way to affect that number. And we are one of the leading states in the top 5 states of per capita of how much we collect. And that shows us how effectively we're getting that message out there about monitor, secure, and dispose of your medication.
Yeah.
Yeah, and I love the Arkansas Take Back in Drop Into the Box campaign, because I think that people being aware that they could have some medication that in someone else's hands could be deadly. I think people thought I had some kind of bladder infection, because I'd come to your house and immediately have to go to the bathroom. I'd be in there raiding the cabinet, seeing what you got. So I love this campaign because it gets rid of medication that is just sitting there.
Well, I think too, Chris, with that being said, what an important time under COVID-19 where people are at home, where families are at home, to really take the time to look at their medicine cabinet, how I can better secure that and keep my family safe. Is so important. We're very, very health conscious right now. And this is a big part of that. Even though we have a pandemic, we still have that epidemic with opioids. And what a great way to deal with that.
Yeah.
I wonder how many lives that would translate to. How many tons did you say? 100 and what?
87.
187.227 tons.
Boy, got it down to the exact kilometer, don't it, Chris?
Yeah, right here in front of
Kilogram.
A kilogram. Yeah. I wonder, man, can you imagine how many lives that is? Because it only takes one pill. It only takes one shot. Wrong shot, wrong day, and you're dead, you know? And so, Chris, you're an overdose survivor. You can definitely relate to that. Most of the times when we use, we don't think that it's going to be our last time using, you know? And
No, I was
so,
in control, man. I knew exactly what I was doing, right?
yeah,
Until I woke up and I had almost died.
yeah, absolutely. So we're coming to the close of the hour. I've got to ask you and Kirk, who is the handsomest of us all?
Are you looking into the mirror? Mirror on the wall?
Well, you know, I don't know. What would you guys like to
Probably
lead?
not you, since you're wearing purple.
What do you mean? I've got these good glasses. These glasses make me look highly sophisticated.
Take a drink and put your pinky up.
Oh, yes, sir. Got it right here.
He's about to take it to an intellectual.
Yeah.
I lost my eggs.
So if you heard that, that was my wife. She accidentally blew eggs up. Yes, we're live.
Hey, so I want to just take a minute. You know, I think every state has a drug director's office, but I just want to thank you, Kirk, for doing what you do each and every day for the individuals and families that are affected by the public health emergency that is addiction and mental illness. So I'm glad to be working alongside you to help families find relief from addiction. And we're so thankful that you showed up today and were able to come on.
Yeah.
It's been my pleasure.
Yeah, and I got to say thank you too for believing in people in recovery. I know better than anybody the type of advocate you are, and so thank you sincerely.
I appreciate both of you guys for your heart and your passion for what you guys do, and that's what makes it work.
Absolutely. So we are getting ready to wrap it up. If you guys will stay with us, Kirk and Chris, if you'll stay on as we close out. Listen, this was just for today. Chris, I'll let you do closing remarks. I almost forgot. We're normally live on Wednesdays and Saturdays. However, our Saturday is moving to Friday evenings at 6. Is that correct, Chris?
Yes.
So we won't be on tomorrow. Sorry, that's why we went live today. Chris, tell them about the Friday change and our closing remarks.
As the summer months come, we are not ignorant to the fact that you all are going to be outside running to the wilderness, the beaches, doing whatever you do. I know that the weekends are yours, and we didn't want to take that up. And quite frankly, you weren't going to wait for us. So we wanted to have a place for you to come in at 6 p.m. We want you to get your TV dinners ready, sit down, have an engaging discussion with us in the evening. And so we wanted to, during the week, we'll have a morning show, and on Friday, we'll have an evening show, just to kind of give you guys some options. Hey, Jimmy, I want you to, I know this wasn't working earlier, but while I do the closing remarks, why don't you put that picture up?
Oh, yeah.
And then we'll end with that.
The leaders make leaders picture. So one thing I've learned, and this picture makes me think of that, because Kirk believed in someone that he had once arrested, we have been able to shape history and the future of recovery for Arkansas. And so what he did when he believed in one of us, Chris, he got us all connected. And so leaders do make leaders. And when we look at each other as competition, we miss the chance to collaborate. And so here's the picture. And
put it up there. So this was, like I said, the Breaking the Stigma baseball game. We had a wonderful turnout. Lots of people in recovery coming to support. Eliminating stigma and shame, those things kill. And so the more we normalize the conversation around addiction, the more we can stand a better chance of, like you just said, collaborating for a solution.
Absolutely.
Taking our own self out of the equation and our egos, putting those aside to work for good. Again, the Recovery Clinic was created so you can continue to get much needed support and accountability. This show's been a great episode. We've had a lot of engaging discussion, a lot of people reaching out today. And so we want to make sure that offline they get the help they need so they can, join the recovery community and enjoy all it has to offer. We will see you Friday at 6 p.m. Thank you again, Director Lane. We'll see you around the campfire.